My name is Tom Backley. I'm the CEO of the Beach Cities Health District, and welcome. We're glad that you have joined us tonight. Our goal tonight is to provide facts and resources and tips and perspectives on how residents can live in the COVID era from experts representing different sectors. So we have some experts here tonight, and then I'm also excited about the fact that we have some youth experts here tonight. We have some youth joining us to give their perspective about things. This is our third session of the Safe in the South Bay series, and we've not heard from the youth yet. So I'm very excited that they are here. We've taken some of your questions already, and we'll be able to have our panel answer some of the questions that you've already sent, but we'll also be taking questions tonight and really talking about how we live with COVID, especially in the holidays. This is something that we've not experienced, obviously, since this began last March, and really talk about what it means to be in this new normal and what are the best ways to support local businesses, schools, and community recovery. And it's something that we all affect through our behavior. And so we're going to hear from our panel about how to do that and answer your questions. So with that, I'll turn it over to Lauren Nakano, who's going to MC, along with Carrie Ann Lawson, the rest of the evening. So thanks again for being here.
Thanks so much, Tom. Good evening to everyone. I'm Lauren Nakano. I'm the director of the Blue Zones Project here at Beach Cities Health District, and it's my pleasure to welcome you this evening. I just wanted to go over a few ground rules and Zoom tips for the audience. One is that we are going to be encouraging and inviting you to submit your questions as we go through the evening through the Q&A feature. So please feel free at any time to drop any questions or comments that you have into the Q&A. The Q&A you can find at the bottom of your screen. The other thing we will let you know is that we're going to be having all of our panelists screens on the whole event, and so you can view that either as in the speaker feature or you can view it in gallery based on your preference. So that's usually up in the upper right corner of your screen. The chat is turned off, so we're opting or pushing you to use the Q&A feature. And then just a reminder that this session is being recorded, as the other two Safe in the South Bay series sessions have been. And we will share the link to the recording in a post-event email that will go out with all of the resources and information that you're going to hear tonight. So there will be a follow-up email that goes out with this recording and the resources. Just want to encourage you again to submit questions through the Q&A feature. We'll probably focus a good half to 3/4 of the time on some of the questions. We got many questions submitted through the registration process, so we'll be focusing on those in the beginning, and then we'll turn for the last 10 or so minutes of this to the questions that come through the chat, but we'll definitely be monitoring those as we go in case we can address them as we go. So we want to next move into the introduction of our panelists, and I'm going to really have fun co-emceeing this with Carrie Ann over the last two sessions, and so I'll turn it over to her to do the first introduction.
Thank you. It's my privilege to introduce you tonight to Zawacki. Zach is a senior at Mira Costa High School and one of the co-chairs for the Beach Cities Health District Youth Advisory Council. Zach is currently involved with Friendship Club, Link Crew. He's a member of the varsity baseball team, and he's president of the Sola Surfs Club. So we are very happy to have gotten on his calendar for tonight.
Great. And I have the privilege of introducing Maya Williams. Maya is an 11th grader at Redondo Union High School and is one of the co-chairs of the Beach Cities Youth Advisory Council, along with Zach. Maya is currently involved in Model United Nations. She's a varsity girls basketball team, and she's also part of the National Charity League. As part of the Youth Advisory Council, Zach and Maya help with the Youth Wellness Center focus groups. They participate in Beach Cities Health District Coalition meetings. and as part of the summer COVID awareness and prevention campaigns. And Maya, thank you so much for being here tonight.
Our next presenter is Dr. James Mckinnell. Dr. Mckinnell is board certified in internal medicine and infectious disease. He received his undergraduate degree from Stanford University and earned his medical degree from Columbia University Medical School. He conducted his internship and residency training at Harbor UCLA Medical Center, after which he completed a fellowship in infectious diseases at the University of Alabama at Birmingham. Dr. Mckinnell's clinical research focuses on epidemiology and management of chronic or resistant infections, with special interest in global infectious disease issues. He also serves as medical director for the Torrance Memorial Hospice Team. Having more than 15 years of diverse experience as an infectious disease and internal medicine specialist, Dr. Mckinnell cooperates with many other doctors and specialists in the Malefichik Rand Medical Group and is part of the Torrance Memorial Physician Network. And I think you can see why from his bio, why it's so important for us to hear from him tonight. So thank you so much for joining us.
Great. And our fourth panelist is Dr. Mo Gelbart. He is making a return visit. He's been on a panel with us before. Thank you, Dr. Gelbart. Dr. Gelbart is the Director of Behavioral Health at Torrance Memorial Medical Center and also the Executive Director of the Thelma and McMillen Recovery Center. Dr. Gelbart is a licensed clinical psychologist. He's a graduate of the University of Southern California, and he has been practicing since 1976. He has expertise in alcohol and substance abuse, is certified by the American Psychological Association in the treatment of substance abuse, and was one of the founders of the Thelma McMillen Recovery Center. In addition to his role at Thelma McMillen, he has been the director of the Gelbart and Associates, a multidisciplinary mental health group in the South Bay for 40 years. The practice recently merged with community psychiatry, where Dr. Gelbart serves as the director of practice development. He has been consulted to the California Medical Board Division Program and the California State Lawyers Assistance Program, and has a wide experience in workplace violence and stress, managed care issues, chronic pain, and works with adolescents and adults in individual, group, and couples therapy. So thank you so much to our panelists tonight. We're really fortunate to have you spend the next hour with us. I'd also like to introduce our Chief Medical Advisor, Dr. Bill Kim, here at Beach Cities Health District. He will also be on and is available to answer questions as well. In addition, I'd like to introduce Jacqueline Sun. She's our Senior Policy Analyst and has done a lot of work with the District Operations Center that Beach Cities has run since COVID began. So we've received many questions about general information regarding COVID-19, regarding health guidance, and also vaccines. So we wanted to first turn it over to Jacqueline to give us an overview of COVID-19 in the Beach Cities as it stands right now. So Jacqueline?
Good evening. Thank you so much. And I am pleased to be able to present really quickly some of the data and trends that we've been tracking at the county as well as in the Beach Cities. I just wanted to draw your attention to some of these graphs and charts here when we look at our state of COVID. Today, an additional 9,243 cases reported in LA County and an additional 75 deaths, which is the highest number that we've seen since late July. You see this chart on the bottom left, it's our average daily new cases, and almost a vertical line in terms of how we've been trending the past few weeks. And so really exponential growth in new cases and unfortunately increase in deaths, hospitalization, positivity rate. I'll take the next slide. This is just a comparison of where we are today and where we were just 4 weeks ago, where we see our daily new cases about a month ago, 1,900, and now we are well over 8,800 new cases per day in the county. That's a 366% increase. Similarly with hospitalizations, which has been a concern of overwhelming our hospitals, over 3,000 cases of COVID in the hospital today. Just a month ago, 849, so we see an increase of 270%. And unfortunately, a 200% increase in deaths reported in the past month. And not surprisingly, our positivity rate, both at the county as a whole, as well as our testing site that we operate at the health district, have increased as well. I'll take the next slide. This is just a breakdown of our hospitalizations. I know that that's been of concern. So we see this very sharp growth in the past few weeks. On the right-hand side, we've just started adding this metric to give some more local data and context to what the hospitalizations look like in LA, as well as our South region, which includes the South Bay. These are numbers reported from the Department of Health Services through LA County. And you see the available staffed ICU and non-ICU beds. Obviously, the hospitals all have surge plans and the ability to surge and flex when needed, but just looking at some of these numbers, we see that our hospitals are very stressed. So we'll take the next slide. So this is just our trends of new cases in the beach cities in the past month. I think historically throughout the pandemic that we've been tracking our city's trends as well as what's happening in LA County. The South Bay and specifically the beach cities have been doing better than the LA County as a whole, but still not immune from these large surges and increase in cases where just in the month of November, the 3 beach cities saw an additional 488 cases, which is more than the months of September and October combined. Next slide, please. So as you may know, we are under a regional stay-at-home order under the state. So the state is divided up into 5 different regions, and we're in the Southern California region. Any region, if their ICU bed availability falls below 15%, we are at a minimum 3-week stay-at-home order. So this, for us, is going to go into effect at least until December 28th. And you see our hospital ICU remaining capacity in Southern California at 9%. And I think that, with what we're hearing is that if we have 8, 9, 10,000 cases per day, about 10% of those will eventually end up in the hospitals, and almost a quarter of those hospitalizations require ICU level care. So you see how quickly we can stress our hospital systems, where this week, every day this week, we've had more than 100 additional hospitalizations just for COVID. The reason that's important on a regional level is that when our hospitals here in the South Bay get stressed and other places get stressed, it's all a network, right? So it's really important that we look at this regionally, because when one hospital fills up, folks need to go to another one. So I'll take the next slide. Just a quick reminder that if you need testing, we are running the testing site, LA County testing site in the beach cities at our health district campus. You can go to covid19.lacounty.gov/testing for more information and to sign up for an appointment. Next slide, please. And so just a brief update. I know that there's been a lot of interest in schools. The governor's stay-at-home order does not impact the school reopening plans of the schools that have already been allowed to reopen for TK through 2nd grade. We continue at the district to help and support the school districts with their reopening plans, especially with mental health and resilience. And you'll hear from members from the Youth Advisory Committee on their insights there. But all 3 school districts have applied for the waivers through the county, and all have been granted. I know that Manhattan Beach welcomed their students back this week for their TK through 2nd hybrid program. And the announcement from the board meetings in Redondo and Hermosa were that those schools will return after the holidays for their hybrid and staggered TK through 2 openings as well. So with that, I think I'll turn it back over to Carrie Ann and Lauren.
Thank you, Jacqueline. So Dr. McKinnell, we'll start with you tonight. Jacqueline's just given us the numbers and they seem alarming. How is this different than the surge we experienced in the summer? And how worried should we be?
So this surge right now is actually really quite different than what we saw earlier in the summer. And there's been a number of different initiatives that have had good impact and other initiatives that have not. In the early phase of the epidemic, a lot of the patients that we were seeing were patients that were in skilled nursing facilities or patients that were closely linked into these types of environments. And patients, when they came in, could very clearly tell me, oh, my exposure event was at this nursing facility or at this event where I know somebody was positive. And I sort of describe that as like a very well-defined contact tracing kind of environment. Since then, the epidemiology or how this disease is spreading is completely different. What we're looking at now is broad-based community transmission. So part of the problem is that we did a fairly good job of trying to contain this early on. And I think a lot of us have learned some habits that may not be ideal. And we said, oh, well, I did well for 6 months. I'm not going to do anything different now. Unfortunately, now really is the time to get very strict about who you're interacting with and how you're interacting with them. So we're really in a community, in a disseminated community spread environment. You can see that not only in the number of cases that was climbing quite highly, but also in the percentage of tests that are positive. So it used to be a few percent, 6 to 8%. We're now looking at 12% of all people being tested are positive for this disease. So we really are seeing sort of widespread distribution in atypical environment. So you have to be careful of every single encounter.
Great. So Dr. McKinnell, we had a question come through the Q&A that's a really good one. The fear is that the medical infrastructure will be overwhelmed. You know, we hear that consistently, really across the country, but here for sure. And so the question, which is a really good one, is there's treatment protocols, you know, when you go to the hospital and you have to get care there. So there's a certain level that you're going to hit when you have to go to the hospital. But if you are COVID positive and suffering from symptoms, but you don't need to go to the hospital, are there any best practices or ways that people could really do self-care and take care of themselves at home if they are in fact sick, but not sick enough to go to the hospital?
Yeah, so there's two parts to that question that I want to tackle. The first is the idea of, you know, what's the potential that we overwhelm our healthcare system? And, you know, we're looking at numbers of, you know, oh, there's only 8% of people in the ICU, there's only 8% of beds available, and how does that look? And I would sort of say from a healthcare perspective, you know, we have some absolutely phenomenal hospitals here in the South Bay. And we have some, to be honest, quite a bit of grit. So we're busy, but we're pushed, and we certainly don't want any more cases because we want you all healthy at home. But at least in the South Bay, we've got tremendous capacity to take care of people. So I wouldn't worry about coming to the hospital. We will take care of you. There's ample capacity. And I'm not as worried about overwhelming the healthcare system in Los Angeles. In other parts of the US, absolutely. But in the South Bay, the community support we have for our hospitals is completely different. But the question really is, so that's first, I'm not as worried about that. But the question is, you know, what can you do if you're at home and you're not quite that sick? How do you know how to approach this? There's two parts to this. Number one, don't infect anybody else. And so that really means when we say social isolation, we mean social isolation in one room with one bathroom. Don't interact with anybody for at least 10 days, maybe 20 days if you're older or there's some process here, but at least 10 days, don't interact with anybody. And that's an important component. The other thing is that I recommend that most people try and get a pulse oximeter. It's a little device you can put on your finger. It's very easy to read. If you put one on today and you're healthy, you're going to see a number on there of 98 to 100, or 98 to 99, somewhere in there. If you're sick and that number drops to 91 or 90, come to the hospital. Because if we treat you early with our current treatment regimen, we can stop this disease from progressing. Jacqueline presented some very fantastic data of an increase in the number of cases that's exponential, but the number of deaths stays almost flat. And that's because, to be honest, we're better at treating this disease. So just like most anything, you know, if you're starting to get sick, please get evaluated so we can treat you early. Don't try to tough this one out at home. If you're really struggling, come in, because we have drugs and treatments to offer you that are quite a bit different than where we were in July.
Great.
So maybe sticking right there a little bit, Dr. McKinnell, therapeutics have improved, but could you also speak to an update on the vaccines we're hearing so much about, and what the front runners are and how they work, and when, most of us, the general public, could possibly expect to be vaccinated.
Yeah, so I think I want to talk a little bit about what we were hoping for with vaccine development. We obviously, the Department of Public Health and CDC and others really put a lot of stock and a lot of money in trying to develop vaccine development. And there's about 4 different candidates that are really leading the charge here. And when we started this process, we did a lot of mathematical modeling to look at how effective would these vaccines have to be to have a meaningful impact on the epidemic. Back in July, I would have told you my biggest fear was community spread. And we're in a community spread phase. So this is exactly what I was trying to avoid. And I said, look, when we get to community spread, we're going to have to lock down. And that's what we're doing. That's a big, important process of this. But the only way to get out of this is a truly effective vaccine. When I did the math, and I'm a super nerd, if it's not clear, I'm a really big nerd in the space. When I did the math, and we did do the math, we thought somewhere in the 50 to 65% range. So in other words, a vaccine that was kind of like an influenza vaccine that wasn't perfect, but kind of good, that would have a big impact on disease transmission. If you could get widespread vaccine efficacy, widespread vaccine distribution with an efficacy in that 50 to 60% range, I was really to be very, very happy. That would have been great. I would have gone after it. So we now have 4 vaccine candidates. There are 2 that are what I would call the novel vaccines, and then 2 that are traditional vaccines. And really, you're going to hear a lot of press about these novel vaccines. The way they work is they act a little bit more like a real infection, where the cells themselves will actually have this protein and present the protein to the immune system. It's a slightly different way of having a vaccine work. It's a quantum leap forward in vaccine development and is actually exciting for other vaccines down the road. But the important thing here is that the quoted efficacy numbers are over 90%. And that's like blow your hair back good. That is just so phenomenal that it's like, okay, great, put the pens down, you won, this is over, great, just get the vaccine out and we're all done. Now, I want to put a lot of caution in on this statement, is that efficacy is just, it's 50% higher than I ever needed. And so I expect that as this vaccine gets rolled out, and we have data from 44,000 vaccines in the 44,000 people in the Pfizer group and 55,000 people in the Moderna group, and that's great. But we're about to do one of the world's biggest experiments with vaccine expansion. And I expect that those efficacy numbers, we're going to go from 95% to maybe even 80%, maybe even 75%. And that would still be a huge win. Early indicators are that we're probably going to stay 90 plus, and that's phenomenal. That really is a different ballgame. So from a does it work perspective, knocked it out the left field fence, like just crushed it. This was tested in patients of a range of different ages, and the safety profile of these vaccines look very, very good. And it's important that people realize that we didn't skip any steps in the development of the vaccine. These vaccines were developed just like every single other vaccine. We just did it really fast. Now I say we, but it's the medical community, so not me personally. So I don't have a stake in this. I'm not biased, but really truthfully, this was developed properly with all the appropriate safety checks. No steps were skipped. And we're doing massive rollouts of these vaccines. They're doing, the UK has launched this countrywide. Canada will launch this countrywide. The US is going to launch these countrywide. We absolutely expect approval for this drug tomorrow. I see no reason why that's not going to happen. And then we're going to have a rollout. And what we're going to find is there are going to be some unique things that we discovered. For example, the UK has just put a warning out saying, anyone who's got a history of anaphylaxis or severe allergy should pause before they take the Pfizer vaccine. We don't know if that's true for Moderna, but we'll see. The Moderna vaccine is probably a little bit more, it's going to be a little bit more uncomfortable than the Pfizer vaccine. The side effect profile looks marginally a little bit worse, but still both very safe. In terms of distribution, what we understand now is that we're going to have enough vaccine to vaccinate 1% of the population sometime between now and the middle of January. 1% of the Los Angeles population. I'm speaking a little bit more carefully here. So the way that vaccine is going to be allocated is it's going to be straight to frontline workers. It's going to be to physicians, nurses, nursing home professionals, really people that are in the face of COVID all the time to try and shut that down. We're going to see big impact in terms of disease transmission when we have 50 to 60% of our population vaccinated. So once we start to get vaccines, guys, all of the beach cities, if we can all get vaccinated earlier, we're all going to be safer earlier. This is going to be a huge campaign. I am happy to do a distance vaccine party. Like, we do want to make sure we get this vaccine done. And to be honest, if we can do this, if we can get our community in the beach cities to really jump on this vaccine process, we're going to see a lot less disease in our environment. We're probably going to see real distribution of vaccines in Q1 and Q2 of next year. So you can plan for mass vaccination availability, in the first half of next year. I think there's a lot of talk about trying to allocate this vaccine carefully, but the fact of the matter is the supply is huge. The price numbers we're talking about for the Pfizer vaccine are dirt cheap. So I really don't see any problem with, large scale mass vaccinations. And, prepare yourself that there's going to be a big rush. Everyone's going to want the vaccine up front. But if you're really strict about isolation, you can kind of wait and take your time and get your vaccine when it comes out. Plus, you get the benefit of us learning about the millions of doses we've given. So long answer, but great question. Thank you very much.
That was a great answer. I mean, I think you hit all the questions we had so far about safety and distribution and all that good stuff. So thank you so much. Again, great information. So to the audience, please put your questions in the Q&A if you have additional ones around vaccines and distribution. We've tried to balance this panel with kind of the medical side and also the mental health and sort of the social side of this. And so we're going to transition a little bit to Dr. Gelbart, starting with you, and we invite you, the other panelists, to weigh in. But what are the ways from a professional or a personal perspective that COVID-19 is affecting youth, adults, or older adults? So I invite you, Dr. Gelbart, to kick us off, and then Maya and Zach.
Well, we are certainly seeing, we're seeing the highest rates of anxiety, depression, suicidal thoughts, substance abuse that we've probably ever seen, let alone in a generation or two. I mean, the mental health community is packed with, with calls. The self-help lines are packed. I think there's about a 400% increase in calls coming into the suicide hotlines in community clinics. So there's an awful lot of stress, anxiety. We've all heard of post-traumatic stress. I think this is present traumatic stress disorder. I mean, we're going through it, and there probably will be, somewhere down the road, and we'll talk about it in a little bit, a good deal of post-traumatic stress as a result of all of this, because we're still in it. Mostly what we have on some level, the anxiety is tremendous, because anxiety is related to fear of the unknown and inability to control things, and all these things that we are presently going through. And you asked about the youth. When I talk to young, and I'm kind of curious what our two high school students have to say, but a combination of when I speak with young people and also when I just observe, I feel sad. I feel the missed opportunities that I see them going through. And they're doing the best they can. They're going to distance learning there, but they're not on their sports teams. I have theater people who are, they just can't be singing and acting in front of their normal theaters and so on. And these are people who are juniors and especially the seniors. It's kind of sad. They're never going to have this opportunity again to move forward. So there's all these missed opportunities that the young people have to go through. And then, maybe another area that I see great effect is the distress between friends and family. It certainly was there it was commingled with the political season, which we are almost over with. But but there's just still so much stress about it's the differences in how people are willing to have their limits and their boundaries, and if it differs, like it's Thanksgiving, well, we want you to come over, well, I don't want to come over type of things. And so there's lots of as I say, stress and distress amongst families. We're going to get to this later. You asked the question, what do we see? There's plenty of, I don't want to paint a bleak picture, because there's lots we can do and lots we can do to compensate and make this, I use the word, we can thrive rather than survive. This doesn't have to be, those are the way things are going, but we have things we can do, which we'll talk about as we get onto this.
Great. So Zach or Maya, do you want to share your perspective?
Yeah, I can go first. So from my perspective, there's two main ways that this is affecting the youth, and that's academically and socially. So from the academic standpoint, a huge part that's been lacking from our environment or our lives are the school environment. So people aren't able to interact with other students or other classmates or their teachers, and it's a lot more difficult in a virtual setting. And I understand that we don't really have any other option right now, but it's definitely made it harder for students to learn. And I've seen a trend of a lack of effort and motivation in my fellow students. So that covers the academic side. And then socially, there's no connections with people. So we can't see our friends in person, can't see others. A huge part of connections happen at school as well. So it's not happening right now. And I think people are feeling really distant from each other.
Yeah, thank you. Maya, did you want to chime in?
Yeah, I was just going to add on to Zach, especially that social aspect that kids, the new school year comes, and this is when, we have time to meet new people or find new groups and find those interests. And especially for those, incoming into freshman year, they just don't have that. And over Zoom, there are different outlets, but it is harder for them to connect and find those social connections that do help kids, especially make that transition into high school too.
So what are the things for the group, and maybe Maya, we'll start with you since you were just talking. What are the kinds of coping strategies that have been working for you or you would recommend to other people to try?
I know many people have said this, but get off of your computer and just go for even a 30-second walk, because it makes all the difference. And just, now we're spending hours on Zoom, especially on school, and just, breathing in fresh air with your mask on, but just having that, just take a step back and refocus and get yourself re-energized, and then come back and approach whatever problem that you might be having or facing.
Zach, any thoughts for your favorite coping mechanism?
Yeah, it's similar to Maya. My main coping mechanism with all this virtual stuff is definitely physical activity. So whether it's baseball or surfing or even going for a walk, just being outside definitely helps in getting fresh air, because we're trapped inside our houses for all day.
Yeah.
Dr. Gelbart, what other kinds of coping things would you recommend?
Well, I think first and foremost, which is sort of an umbrella for a lot of it, is we have the ability, to work with and sometimes change our attitude about things and change how we see things. Our feelings are a result of how we think. And so the narrative that we tell ourselves about things determine how we feel. And if we are telling ourselves things that are, I'll make it very simple. The proverbial glass half full and glass half empty. If we look at the glass half full, we feel good, we feel up. If we look at the glass half empty, we begin to feel down and sad. And so the great thing about that is, in order for that to change, the glass doesn't have to change. In other words, so we can't control our environment. We can't control what's going on, but we can begin to take a look at those negative thoughts that we're putting in our heads. And they don't have to be tremendously negative. They could be subtle, but they change how we feel. So I work a lot with people on a couple of major things. One is, I tell people to change one word, go from what if to what is. Because what if is a form of catastrophizing. And when people are saying, well, what if this happens? What if my family gets COVID? What if I can't see them on Christmas? What if? And before you know it, you're in a downward spiral of disaster. And I ask people to take a breath and ask yourself what is, because what is means what's happening in the moment, in the present. And it also allows you to do something about that. We can a little bit better control the things we can control in the present. So it's real important to stay focused on our thinking, not going down some rabbit hole of catastrophizing. And, those are things we can actually work on. We can work on our attitude towards things and change the way we feel as a result.
I'll build on that a little bit. I think Dr. Gelbart really has introduced a really important concept, which is to think a little bit about what are we actually dealing with and how much control do you have over this? And part of this is if you can control your environment, if you can, make yourself separate from other people and reduce your exposure, your risk here drops significantly. And when you start to think about the stresses of, how do I deal with family dynamics, or should I do this, or should I do that? A lot of those shoulds become very difficult to deal with. And, I think one of the lessons I learned very early on was, if you're working through a challenge, and the classic example is hiking in a backpack. If you're hiking up a hill with a backpack with a bunch of people and you see somebody who's struggling, if you can reach out and help that person a little bit and take on some of their burden, and the example is, take a little bit out of their pack and put it in yours. If you're helping somebody else, or you're helping your family and you're strengthening your family, that building dynamic and just, we can do this kind of attitude really has a big impact in your engagement. And golly gee, do your neighbors really appreciate that? And that could be something as simple as being a little nicer to your neighbor, being a little bit nicer to the guy in the checkout stand when you're stressed at the supermarket, saying thank you a little bit here and there, and really sharing that and building that community. So I do think taking a little bit of a positive attitude and actively engaging is a good idea. And as Zach has said, we can all probably do a push-up challenge and a squat challenge to try and keep our head in a good spot. So
yeah, and thank you. That's well put. And I'll add one more thing, because it prompted one other area, which is close to, reaching out and helping others is one of the foundations of well-being and happiness. Research in positive psychology shows that. Another one which we can all practice is gratitude, which is closely linked. And this is not some Pollyannish kind of gratitude. If we all think about, when I watch what's going on in the country and I see the little long lines of people really hurting and both physically and financially and having no food on their table, I wish there was more I could do, but it allows a certain amount of gratitude for what we're going through. And if people practice, and it's very simple, you can literally every day ask yourself at the end of the day, what are 3 things I'm grateful for today? And they don't have to be big things. And again, it's not just a feel-good thing, but scientifically, research indicates that it has a tremendous impact on your well-being.
Yeah, thank you so much. I think that's a really nice transition, because one of the things we wanted to ask our panelists are any resources that you would want to share with the audience that you would recommend for people who are struggling, and I think you guys framed it up really nicely, but are there any specific resources that might be useful to folks who are struggling? So Dr. Gelbart, do you want to kick off, and then we'll have...
Before I do that, great question. I think it's important to first, at least address for a moment, a lot of what we're talking about that we're all feeling is normal, appropriate. I hate using that word normal, but normal, appropriate. And so when we think about going out and getting what resources are available, we need to keep in mind that these issues and these consequences are on a continuum. And most of it is things, the main resources are your loved ones, your friends, people you care about, people you can talk to, someone who is not going to judge you, and so on. But there are people on the other end of the continuum who are suffering a little or a lot more. And, and when it turns into some really painful situation or really dysfunctional, they can't get up, they can't go to work, they're drinking too much, and, certain consequences of that nature, then we have to look at what is available. And we're blessed in a community with a great deal of resources, starting with, of course, quite honestly, Beach Cities Health District and what they have to offer in terms of, community resources and education, and then we have a number of free clinics and community mental health clinics that are available. We have a great amount of private practitioners, psychiatrists, psychologists, marriage and family therapists. So we are, as I say, blessed with a great number of resources. I'd be remiss if I didn't at least throw out South Bay Families Connected, which many of you are familiar with, but you go on their website and you will find information and direction and help with almost any problem that we're going through. And so we have so much available, and much of it is available either for free, or it's available for low cost, or it's available covered under your insurance if you have to go to some professional care. So cost is not an issue.
Great. Zach, do you want to, oh, go ahead.
I think I was going to do the same thing, Lauren. I was just going to say to Zach and to Maya that, now's your chance. You have a captive audience of adults. I think many of us share Dr. Gelbart's sense of sadness for what's happening to our teenagers. What do you need from us? How do we help you cope? How can we best support you?
I was going to say too, especially the parents out there or students out there that go to Redondo, the teachers are so helpful and they're so there to help you. And I know a lot of that stress and anxiety stems from, an overload of homework and, stressing to try and get good grades in this, impossible situation that we've been put in. But the teachers are there to make your lives easier, and going to those one-on-one sessions and Zooms, just to even like debrief and have them help you to work through stuff. Especially I know at Redondo, they've been really good about doing that. And then to also add on, going back to those coping, understand that mindset of having to seek out those helpful, if you're struggling with depression or anxiety, it doesn't make you in any way weak or lesser to go and find those, resources, and shifting that mindset, especially I know still in teenagers have that. So yeah.
Along those lines as well. So the main thing I kind of got from Dr. Gelbart and Maya are people. So definitely my advice would be to reach out to people, whether it's a friend, family member, parent. Everyone's going through the same thing, so they can empathize with you. So I think it's really important to reach out to people for help.
Yeah, Zach, I really think you hit on something there with that outreach to people. I'm blessed with some really truly phenomenal friends that I can reach out to and talk to. Sorry, gentlemen, but I already have the best wife in the world, so I do lean on her quite a bit. And really, those sort of connections, those social connections, they're really helpful. And if you have them, please do take advantage of them. And there are other resources out there. I know that our community has been very supportive and very engaged. I know that, I've reached out to people in Hermosa Beach, like Hanny Fangari, when I was sort of processing how this is all going to work. There have been people that will step up and help you. And I think, reflect back to the comment is that oftentimes if you reach out to somebody and say, can you help me with this? You actually benefit those people. They in their work of helping you, it lifts them up. A rising tide lifts all boats. So don't be hesitant to reach out for emotional support from either professionals like Dr. Gelbart or just your community in general. And the Beach Cities Health District and the other resources around, they're great if you can engage with those, but you can also engage locally with the people that are in your house or other spots. So really think creatively about those solutions, because this is the time to buckle down, to say, look, we're going to sort of stay relatively insular, keep our crowd together, and you've got to have a strong base to do that.
Thank you. I'd like to add one more thing to that because it's so important, and that is, and I'll make it brief. It's not only reaching out, but it's the quality too. In other words, I'm big recently on talk so people will listen, and listen so people will talk. Mm. So you need to be around people who will hear you, not judge you, not tell you what you should do, not offer advice that's not asked for. I call it help not asked for is criticism. and be able to validate how you feel. And that's really important. It doesn't have to be a lot. You don't need a lot of people. But if you have 1 or 2 or 3 of those kind of people in your life, even one, that's enough.
Thank you. So we're going to move the conversation to the future, if you will. But before I do that, Dr. McKinnell, we've had 2 kind of medical questions. One is about asymptomatic people and how many there might be amongst us and what their experience is. And then the other question is about pregnant and breastfeeding women who have not been part of the vaccine trials and what your advice to them would be about taking a vaccine.
So there's the 2 questions. I'll take them obviously in 2 parts, but in terms of the asymptomatic component, this is a huge problem. And it's actually bigger than some people think about, because there's asymptomatic, which means I have no symptoms of disease. And then there's symptoms that are so mild that I would just blow them off.
Mm-hmm.
And as we're starting to deal with community spread, our entire population is driven by the idea of I'll still show up to work even if I'm a little bit sick. And this is a disaster. This is why we're seeing such rampant transmission. When you talk about 70 to 80% of patients will have no symptoms or mild enough symptoms that they'll still follow through with something, this is the real accelerator. I'm dealing with dozens of patients who got sick because someone felt, quote, a little under the weather, but still went to Thanksgiving. The fear of missing out, plus the stress of like, I just need to connect with people. They came to Thanksgiving and infected dozens of people. So this is a really tricky status, and really it is 70 to 80% of people are gonna have essentially nothing. You'll blow it off. You won't think anything of it. And then you'll infect someone who will truly get sick, and it's a tough one. The second question there was about pregnant women, and this is a tricky question because I want to answer it carefully so that you understand why pregnant women and breastfeeding women weren't studied. The unfortunate reality of a lot of clinical trials for novel medications or for vaccines is that people are very reluctant to try them in pregnant women. And the reason why is that if there's an adverse event and if a fetus gets harmed, it's very expensive. And I hate to break it down in just dollars and cents, but it is not a population that many pharmaceutical companies want to experiment on. As a physician, it scares the living daylights out of me. Like, I have a hard time dealing with small children because I just am so afraid of hurting kids, like personally. So it's a very difficult population to study. So pregnant women were not included in the initial trials because you wouldn't really want to experiment in that population unless you had good evidence that it worked. So they were not included in the first phase. The clinical trials of vaccines in pregnant women are ongoing right now. So we have plenty of women that are being vaccinated right now in terms of those clinical trials. And really, you want to think a little bit about what that means. That means that it probably will work in a pregnant woman, but we're not sure how it's really going to play out. So we want to watch that carefully. So if I were a pregnant woman right now, in fact, my wife is pregnant right now, and I'm going to tell her, look, I'm going to get the vaccine. You're very well isolated in our current environment. You don't have to have a lot of exposures. So you're not at super high risk right now. So we can wait and see what those trials do. If I had a nurse who was potentially exposed to patients with COVID, I would say you should enroll in a clinical trial. And that's because we really do want to study this and understand it. And if you can't enroll in a clinical trial and you are at risk for exposure, let's say you're a very busy person who's working in an environment where you see a lot of people all the time and you're very scared about exposure and you are pregnant, if you want to consider getting it, you really should talk to your healthcare physician. Honestly, it's probably safe. It's probably no harm to the fetus, probably works just fine for you, probably honestly protects the fetus a little bit. But there's just not enough data to answer that question with real science.
Thank you.
Thank you. So one of the questions as we're getting close to the end, we wanted to put out there is, this is unprecedented year, which is now unprecedented holidays. And so we're all trying to just get through the holidays and have some semblance of joy and festivities and love. What from a kind of a clinical perspective, but also just from a very practical perspective, if you guys could share, what are some of the behaviors that you are going to adhere to over the holidays, especially after all the great information we've heard today, that's really going to, advance us towards recovery, but also, part of like decision making in terms of the choices people are making. So what are some of the protocols or the things that you're going to adhere to over the holidays? Yeah, go ahead, Mo.
Well, I'll go first. Since you framed it, and what am I going to adhere to? Yeah, I call myself a COVID extremist. I've been real careful, but not careful enough because I'm still out there sometimes. But anyway, I have grandchildren. They come over on Sundays only outside. I haven't seen haven't touched her or my grandchildren in 10 months, or have them in my house in 10 months. That's sad enough. What's more sad, and we may not get to this, is I don't like the fact that they understand all this. It's kind of scary to me that my 4-year-old says the word quarantine. I'm thinking, oh my God, who would have ever thought that, that they would know that word. So what I'm doing personally is we're in the middle right now of a 2-week self-quarantine, all of us. We're going to form our own little NBA style bubble. And after we all quarantine and don't go anywhere for 2 weeks, we'll go get tested. I already have my appointment. And then we'll spend a week to 2 weeks together in one household. That's how I personally am handling it. But I think the important part in terms of this panel here is two things. One, I'm being careful, and I think we all need to be, based on what Dr. McKinnell said, we knew that anyway, but we need to be really careful and think about, the risk reward aspect of our behaviors.
Yeah, thank you. Dr. McKinnell, did you want to?
Yeah, that's, to be honest, that's a great answer, guys. I really think the idea of thinking about this of risk or reward is really important. I think we're in a very different position today than we were 2 months ago. Because the epidemic is totally different today than it was 2 months ago. But we also, there's a little bit of light at the end of the tunnel. And I'll be honest, standing right now, science is winning the game. Like, we're in the 4th quarter. We're right there, so we're science is winning this game. We're right there. And you can blow it. You can completely end up ruining this game by fumbling the ball on the 3-yard line. You absolutely can do it. And what you heard Dr. Gelbart talk about was right now is the time to just push through those last few minutes. Just get through it. And once we come out the other side, if the vaccine's working and we're able to distribute it and it's effective, we can all let our guards down a little bit. And, the idea of establishing a quarantine is very important. If you can make sure you have your limited people with whom you interact. My group is 5. There's 5 people that I will interact with. And if you're not one of those 5, you're not in my house. I'm seeing you outside, but I'm wearing a mask. And, my reality is that I'm the biggest threat to anyone. I see COVID patients every day. So I would not let any of you get near me. Like, don't do it. And for the next few months, double down, be very strict, but we have light at the end of the tunnel. We're just about there. Turn to your people, turn to the people that love you, that care for you, and say, look, we can get through this. Keep that unit together, keep that quarantine, and then finish it out and just finish the game.
Great. Excellent.
Zach and Maya, Dr. Gelbart alluded to it earlier. You've given up a lot, especially this last year. So are there things for you that, you're committed to get to the finish line?
Yeah, I think, I can't remember the last time I didn't get to see my grandparents on Christmas, and that's just something that we've done every year. And this year we're not doing that. We're going to just keep it the same 5 people in my house that we are and just have a nice quiet Christmas this year. And then, usually too, the next morning, this is like prime basketball season. So December 26th, we go up to a tournament and are playing for the rest of the week. And, unfortunately, there are actually tournaments going on right now, but, not doing any of that. And while it's really hard to have to miss out on that, that's just the reality right now.
Yeah, thank you. Zach?
I think 2 things about it too is there you need to look at it from a mental perspective and then a physical perspective. So I think the biggest part of going into the holiday season, the biggest thing people need to do is reset expectations. Like this isn't going to be a normal holiday season. So you're probably not going to see, your grandparents like you're not going to see your family. It's not going to be huge. Everyone's opening presents under the Christmas tree with your entire family. So I think if you are going to go see them, make sure you test negative at a testing site. But again, just resetting expectations. And then the second way to look at it is what you can do to for yourself on a personal level. So for me, I'm constantly washing my hands. I'm always wearing a mask. And it's just, those are 2 really easy things to do, but not everyone does them. So
Right.
I think just honing in and focusing on the little things and the easy things that you can control are really important.
Thank you so much.
Definitely.
So our time here is almost at an end, and I want to thank you all for everything you've provided tonight. It's really been fantastic to spend this time with you. Before we invite Tom back for closing remarks, I'd just like each of you perhaps to share with us in the spirit of the holidays, what gives you hope right now?
I'll go first. First off, a lot of what Dr. McKinnell said gives me hope, but the and some of what we've talked about sometimes seems a little too dark, and I do want to say, like I started to say, we can thrive and not survive, and we, new challenges bring new opportunities, and this too shall pass, as they say in our 12-step programs that we run, but I do want to take 2 minutes to give you my favorite parable, which I think fits here. And this is when you feel overwhelmed and you feel like there's too much and you can't do anything, and there's just, like you just can't make a difference. So once upon a time, there was an old man who every day would walk on the beach. And one day after a terrible storm, he was walking on the beach. The beach was littered with starfish, and off in the distance, he saw a little boy, and the boy was doing something he didn't know what. And as he got closer to him, he saw that the boy was picking up things and throwing it into the ocean. And then as he got even closer, he saw he was picking up these starfish and throwing them in the ocean. The old man said, "Well, what are you doing? There's 1 million starfish here." He said, "Well, I'm throwing them in the ocean so they live." He says, "There's 1 million of them. You can't make a difference at all." And the boy bent down, he picked up a starfish and he threw it in the ocean. He said, "I made a difference to that starfish." And that's how we can take a look at things.
Other thoughts of hope? Maybe Zach, I'll call on you.
Yeah, sure. One thing I'm hopeful for is that I know everyone's going through this together. So it's not like, just one person is suffering or one person is being restricted from seeing their family. So it definitely fills me with hope that everyone's going through this together.
Maya?
Yeah, like what Zach said, if you ever feel like you are missing out or something, realize that everybody is in this together and we will get through it. And, looking to do the hard now and make sure that we're doing what we can to stop this, and know that in the future there will be a time that we can have what life was like before, and just getting to that point is what's going to be key.
And Dr. McKinnell?
There's a lot of things that I think are important to think about to give us hope. And really, I said it earlier, science is winning this battle. Like it's a battle and science is winning this battle. And I give thanks every day to the people I get to work with and the difference we really get to make. Really, the nurses that I get to work with, the physicians that I share time with, the respiratory therapists, everybody in the whole system from the hospital I work at Torrance Memorial, really, they do just spectacular work. And I'm blessed and I really appreciate the ability to take care of the 1,100 COVID patients or 1,500 COVID patients that we've, cured and discharged from the hospital. So that really should be a light thing. Oh yeah, the doctors are engaged, they're doing the right thing. We've got good treatments, and that's a good thing to be excited about. We've got a vaccine that's coming. We're winning the game, guys. It's tough. But when you talk about what gives me hope and what gives me real excitement, it's certainly community. It's certainly the people that are willing to get on this call and support their neighbors. But honestly, it's my friends and it's my wife. Really, that really tight bond of, it doesn't much matter how long my days are, how bad my days are. I really have a strong support network that I lean on and they lean on me, and it builds us both ways. So really focus in on that. And, I think there's a lot of things that Dr. Gelbart said that I'm going to take to heart to build those again. And that's exciting when I can think about making my life better today. That has nothing to do with COVID, out the door. I'm going to work on this and I can control this. That gets me happy. That gets me excited. That and decorating my tree. That's the other thing I'm going to do tonight.
Very good. And then Tom, I'll turn it back to you for closing remarks.
Great. Thank you very much, everybody. And I want to thank our panel. That panel gives me hope. And so we really appreciate you being here tonight. I want to thank staff for pulling this together. A lot goes into making this happen. So I'd really like to thank staff for pulling this together tonight. Here's our information and referral line. If anybody has any questions about anything, but especially about COVID, would urge them to call 310-374-3426. Extension 256. If it's on the weekend, leave a message and someone will get back to you. We do check the messages over the weekend. And yeah, I have more hope after listening tonight than I did this morning. We are not going to have our son join us. He goes to college in Idaho. He's okay with it, but my wife and I thought, wow, we don't want him to be alone. He's going to be with close family, friends, and it had to happen sometime, right? And so again, want to thank you for being here. Here's our school well-being line. Also want to make sure that you have this number as those of you with kids in school here in the 3 school districts. Please call this line at 310-374-3426, extension 256. Again, we will help you with any questions that you might have. Please refer to our website as well. Lots of information there. And we have what we call a Coven Dashboard that we update daily with information. You saw some of that tonight. These are our partners, of course, at Thelma and Torrance and South Bay Families Connected. There's no way we could do all that we do at the health district and do with you in the community without these partners. And then we also have here the suicide prevention hotline. So again, this is also something you can do. The Safe in the South Bay program is one that we're doing for everybody. It started out with the businesses, but we urge you to take the individual pledge. Some of you will be reminded by the Blue Zones pledge. This is similar to that, but it really is related to COVID and what you're willing to do to change your behavior. And we hope that you're willing to take a look at that. Again, want to thank our panel and thank you for being here tonight. Be safe, and if we don't see you, have a happy holiday, and we'll see you soon. Thanks for being here.